And many thanks for inviting me for this webinar. Actually, I tried to address these questions regarding Central and Eastern Europe. We already have a nice global walk around each and all main parts of the world, but currently there is growing interest towards Central and Eastern Europe. So I think it's really high time to talk a little bit about these countries, what's really happening in this region. Earlier this year, I was asked to participate in a patient academy, and we tried to elaborate kind of challenges which patient organizations are facing. Probably many of you might experience these difficulties I put on this slide, but I tried to put from a different angle, from the Central European patient perspective angle, which is based on some interviews I already have within the region. So main topic is the funding. As you might know, there are not many pharmaceutical companies which are registered or based in Central Europe. So it's very difficult for these patient organizations to have a sustainable long-term financing, which is essential for having, for instance, an office or long run projects. Another problem, which is actually a big problem for Central Eastern Europe patient organizations, is the critics on independence and reliance. I think many of you might have read articles from the United Kingdom where patient organizations are considered as the long arm of various pharmaceutical companies because they are advocating for earlier diagnosis, which might generate more selling of the pharmaceutical products or using more medical devices. But for instance, in Central and Eastern Europe, it's another type of dependence we experience. What I'm talking about is that the link is to physicians. Actually, we already experienced some of the patient organization, and it's related to pulmonary hypertension. The vice president or even the president is a physician, which is quite strange if we take into account the very definition of the European Medicines Agency of patient organization, which should be patient-led. And probably you might also recall that within the World Symposium proceedings, we also relied on the European Medicines Agency definition. However, we also provided additional recommendations. So it's quite strange. I also heard from the Eastern European PH organizations that they are so linked to one of these top centers that actually the leading physician asked the president or the vice president not to contact the countryside expert centers in order to enroll more patients in the patient organizations. So I think it's critical and it should be addressed. Stability. Sadly, we experience from the pulmonary fibrosis community that the leader passed away as a result of COVID. And what we saw that the whole organization collapsed. So we needed to rebuild all the connections to pharmaceutical companies as well as to the patient community, because usually it is the case that a charismatic people gathering and collecting all the help or the patient community. And once we have this main person out, we experience this problem. So it should be a kind of approach in each and all patient organization to build a kind of internal structure in order to replace if someone is having difficulties, for instance, as a result of his or her disease, having other type of commitments, which does not allow for him or her to push more and devote more time to the patient organization. I think professionalism might be also something important to be addressed, especially in Eastern European countries, where you might know lots of EU statistics that many patients do not speak foreign languages, which actually a difficulty when it comes to cross-border advocacy. And last but not least, these two lines is about how patient organization tasks are outsourced. I think it's also you can experience in other countries, not specifically in Central Eastern Europe, that some of the pharmaceutical companies are issuing their own specific leaflets and handouts, which should actually be the task of patient organization, collecting many aspects as well as many opinions from various pharmaceutical companies. It is especially difficult in Eastern European countries where they lack a little bit of resources, as I already mentioned. So they need to rely on these papers, these materials. And last but not least, we experienced in Eastern European countries that some of the activities which usually should be within the healthcare system, like psychosocial support and so on, actually it is delivered by patient organization, putting extra burden on the shoulders of these relatively teeny organizations. But I would not like to be very pessimistic. So what kind of opportunities we have for these patient organizations? Sadly, there's no pulmonary hypertension representation in the health technology assessment. I will cover this a little bit later on, but I think it's a magic word and everybody is really talking about this. But pulmonary fibrosis is within the EU HTAR stakeholder network, so there's probably there might be some collaboration on this. Research might be also something which Pulmonary Hypertension Association within the CE region might be interested or involved. We see increasing interest towards, for instance, Baltic countries. Gossamer Bio with their drug, they managed to onboard many patients from the Baltic countries, so for seralutinib. And we also see that, for instance, PH-ILD trials are or might be happening in some of the CE region. Luckily, there are many ongoing trials, so pharmaceutical companies have more interest towards CE region, onboarding those patients who are not enrolled in other clinical trials, which might be exclusion criteria for other clinical trials. Collaboration might be also interesting. I will cover this later on with HTA and participation in scientific world. I will show you some publications which might be really interesting for CE region patients. And sadly, you will not realize many patient co-authors in this, which is not really the case in Western European countries, where we usually see at least one or two co-authors, which are patients or patient representatives. Last but not least, advocacy. I think that it should be not covered at that point in more details. I will bring some real evidence and some examples, exact examples from some of the countries. But before we dive in the HTA words, I would like to say some words about ERN-Lung. Based on the participants, it seems that many of you might be familiar with this structure. But I think there might be two really important things which I can bring up. So in one word, ERN-Lung is a network of healthcare professionals. They are mainly expert centers, but we closely work together with patients. So in the heart, we have the patient board. There are many initiatives. The undiagnosed patient one, the Go East one. We have a very special registry for patients. So let me take this opportunity to promote our Breathe e-registry. So you as a patient or patient representative or caregiver, you can input your own data without the help of any physicians, and with that we might have a better understanding of the patient population in each and all countries. And naturally, everybody is really interested in the patient journey. So together with ERS and the European Lung Foundation, ERS stands for European Respiratory Society, we build up a comprehensive patient journey. And already regarding CE region and related to ERN-Lung. One of them is the Go East project. I'm the one who is responsible this one. I leave you some minutes to have a closer look on this spreadsheet where you can see pH, how it is represented in Eastern Europe. And you can see there are many, many white spots. But luckily, since the launch of this program, we managed to have a pH center in Hungary. Also, we have two in Greece. I'm in a very long discussion with Barbara Salobir from Slovenia. Hopefully, they will submit their application so we can also go a little bit to the Balkans. And it's very difficult to build some bridges to Bulgaria. And last but not least, Romania might be also in our focus. Most recently, we managed to onboard a center from Timișoara, but they were not approved for pulmonary hypertension, but for other rare lung diseases like ILD, PCD. But I hope that because there's an ongoing discussion with one of the key opinion leaders from Bucharest, that there might be a PH center also in Romania. I think it's crucial because they already almost have 20 million inhabitants, and it's a pity that they are not part of this EU-wide collaboration. The other interesting one, and I just putting more emphasis on Romania, is the participation of the ERN-Lung Academy. So 2 or 3 years ago, I was a great advocate in terms of having more and more applicants from Eastern European countries, and somehow we managed to break the wall because, as you might see, the top country in terms of the number of applicants is Romania, but also other Eastern European countries are well represented. This ERN-Lung Academy is a great initiative because it provides a practical on-site stay for junior colleagues. So, and I already talked about a little bit HTA. So European Pulmonary Fibrosis Association is part of the HTA stakeholder network, and I think each and all patient organizations should be prepared for this because, as you can see, it will be a step-by-step coming into force, and in 2028, rare diseases will be in the scope. So currently, we can learn a lot from oncology and advanced therapies. However, when I was talking with local HTA bodies, it's very clear that in Central Eastern European countries, mainly there's no contact towards patient organizations. And we see that many pharmaceutical drugs are in the pipeline, luckily. So it might be expected that going forward, the clinical assessment, which we call the joint clinical assessment, GCA, will be conducted in some of the PH drugs. So each and all patient organizations should be prepared and be contacted and be in contact with local HTA bodies. So in the right-hand side, you can see what will be the new structure. So there will be a centralized EU-level assessment, but some of the tasks will be at member states level, like definition of population, comparators, and also reimbursement questions. And as we learned, if the local HTA bodies do not have exact connections to Pulmonary Hypertension Association, then they will connect big umbrella association. And for instance, I participate in the COPD World Day, and I was really surprised that, for instance, there's no COPD organization, patient organizations in CE region. So what they are having a look at, they are looking at bigger and more general patient organization like EPF on a European level, and probably they might not have the professionalism as well as the knowledge of pulmonary hypertension or other pulmonary diseases. So I think it is a crucial step that each and all patient organizations should contact the local HTA bodies in order to be registered for this. Next slide, please. And why I was talking about a lot, because you might find it very difficult. Probably it's a little bit busy, but I copied it from a very current paper which was published in the pulmonary, I think it was a Polish Heart journal, thanks to Gregor Kopec and others like Pavel Jansa from Prague. And it's a very nice comprehensive table, what kind of therapies are available or actually reimbursed in C region. I think it's a common practice, not only in Central and Eastern Europe, but also in Western European countries, that mainly those drugs are available actually, which are reimbursed because these drugs are very, very expensive. But you can see that many oral treatments are available in Central and Eastern European countries. However, epostenol and Sotatercept are not available in most countries. You can also see that registries are missing in many, many countries, and I will go back to this once I will talk a little bit about country-specific. Next slide, please. So I tried to collect lots of pieces of information regarding the reimbursement of Sotatercept. I managed to get in contact with Merck, and they said that, okay, however, we might have some publications regarding
Uh-oh. I lost him again. Yeah, Dare says cut off. Thank you. Sorry, everyone. We may have to just schedule a makeup for this last presentation.
I'm back again.
Oh, back. Okay.
So something happening. Probably I'm talking too long, or it's not very interesting topic for you. Probably I will skip some of my slides. So apologies again for this. So you can see it's nicely balanced, and it's not always depending on the reimbursement, whether it's a huge market or not, or whether it's based in Central Europe or not. But I think it's might be interesting in the coming months. And some advocacy activities might be also needed also in the HTA stuff, that some of the medication, I mean the Sotatercept, should be available in other countries. Next slide, please. And probably you might be eager to learn more about some of the examples from Central Eastern European countries. So I tried to build on some publicly available sources. I participated in some of the activities, and also there are some artificial intelligence research based on this. I think Bulgaria might be interesting from this topic. You might recall that even from the Go East project, it's a kind of a wide spot. There were many, many elections in the past in Bulgaria, so it's not a very stable healthcare system they are having. They are struggling with many, many personal changes. So probably it might be some of the reasons why it's not very established. So I think some of the numbers are shocking here. So if you see that 90% of the PH patients are class 3, it is a very important and shocking indicator that there's no early diagnosis of PH in Bulgaria. But there are also follow-up challenges, as you can see, that many, many patients are lost. Probably it might be the case that some of the patients are misdiagnosed. So this is what we understand, that once you are not reacting nicely to some of the medications. It might be the case that the patients are not living with that specific disease, or probably there are comorbid diseases also. So this might be also the case for the follow-up. And in reimbursement, there might be also some difficulties because there's a monotherapy dominance. Next slide, please. Yeah, so the Czech Republic, I already referred to Pavel Janssen, Prague, and some of their activities, but they also worked a little bit on the updated treatment guidelines. And I think we already heard some of the burdens of PAH from Japan, and it's nicely reiterating such kind of statements we already heard, that the PAH has a very big impact, financial impact on people living with the disease, also on their work engagement. This is the second article is about. Next slide, please. To have some colorful pictures, I brought Hungary from this perspective. However, I know that there are other activities. On the left-hand side, you can see nice collaboration with the transplantation organization in Hungary. They are really relying on Dora's expertise, who is also a transplanted PH patient. And on the middle and the right-hand side, you can see some of raising awareness activities, which I think also important and put Hungary on the map in terms of active participation and advocacy. Next slide, please. Poland, the biggest CE region country, so there might be lots of interesting news from their end. But I need to emphasize that this report I'm providing in CE regions might not be complete and might not include the most important ones. It is based on, as I mentioned, some research and so on. But I think some of the topics might be a kind of heads up. So one of them is this reimbursement issue. I already talked about this. I contacted Merck, and they said that actually this is not the case, which can be seen in this slide. So it is not reimbursed in Poland. So I'm waiting for the very last and final judgment on this. I do not know what the exact situation in Poland. However, there is also some nice publication on expert consensus on emerging therapies, also in the Polish Heart Journal I already referred to. And I think COVID is also a very interesting topic, especially on long COVID, how the patients have been impacted. We already have some publications, but I think from helicopter view, it might be also an interesting topic. Next slide, please. Romania, and I see that we have a representative from Romania, and I think you are also on the picture next to Bogdan. As I mentioned, Romania it's a very big country, and sadly, in the past there were not many activities, or probably there were activities, but was not very visible outside the country. But I can bring, luckily, three pieces of information in terms of Romania. So on the left-hand side, that it was included in PHA Europe's Good News, there was nice advocacy activity with the coalition of organization of patients with chronic disorders. So you can see that PH patients were working together with other disease areas. And on the right-hand side, you can see two programs related to PH. The bottom one is a Romanian-European dialogue. It was PHA Europe, which participated and contributed to that one. It happened in Târgu Mureș. The other one happened in Timișoara. I was invited to speak there, but due to other commitments, I could not make it. But this is also another PH-related event. And I'm really happy to see that patients are involved and they are participating also, not as only an audience, but also as a speaker or part of a panel. Next slide, please. And I think that will be the last one. And Apologies if it were a little bit more than expected, but I think Slovakia should not be missed. It's a time of running marathons and half marathons, and it's good to see that many advocates and ambassadors are participating to raise awareness in Slovakia. But also, it's important to underline that Bratislava is a very important center for CTEP patients, and they are part of international cooperation. And with that, I would like to thank for your attention, and